Hi, it's nice to know that you are there. It's nice to know that you're safe, and it's nice to know that you are sound. And I hope you're following all precautionary measures that have been put in place to ensure that you and your family members are safe throughout the period of this pandemic. I am North Maxwell Okon, and courtesy of Health Circumference in commemoration of the 2020 International Nurses Week, I'll be taking a topic titled Maintaining a Healthy Heart. So we go straight to the point. The heart is a hollow muscular organ that is found in the thoracic cavity in a space known as the mediastinum. It is bounded laterally by the two lungs, and the size of the heart is usually about the owner's fist. The shape of the heart is a cone shape with the apex facing downward and the base facing upward. The weight of the heart in females is usually about 225 grams, and that of males is usually about 320 grams, which simply implies that the heart in males is heavier than that of the females. The heart has a lot to do with the general functionality of the body, since it is responsible for pumping blood and circulating same with oxygen and other needed nutrients to all other body parts. So a default in the functionality of the heart would definitely lead to other problems in other body parts. For instance, an increase in blood pressure, which is primarily concerned with the arteries and other blood vessels, would ultimately pose higher demand on the heart, which will in turn lead to cardiomegaly, that is enlargement of the heart. So there are certain habits that do not conform with what human beings are supposed to do in order to maintain a healthy heart, and I'll be pinpointing some of those habits for you. One of them is smoking. Research has allowed us to know that smoking is related to increase in blood pressure and tightening of arteries. And then one wonders what happens when the arteries, that the blood that is being pumped by the heart is supposed to pass through, is blocked. So you've seen that a problem to one part would necessarily lead to a problem in the heart. There are certain disease conditions that are actually associated with smoking. One of such conditions is the stroke, which is usually as a result of blood clots or air embolus in the blood vessels, leading to the condition stroke. We also have atherosclerosis, which is as a result of deposition of fats in the blood vessels, and then we also have peripheral artery diseases, which results in deficient blood supplies to the extremities. That's where you have conditions like the pedal edema. We also have alcoholism. Alcoholism is also another major fact. Alcohol is, by research, seen to increase blood pressure, which is not good for the heart. We now take you to unhealthy eating habit. This is a very important part of it. Unhealthy eating habits like taking junks, excessive sugars, excessive intake of salt, which will cause reabsorption of fluid and thereby bring about an increase in the viscosity of blood. So excessive salt is not good for the heart. Then irregular fluxing, also, that's using a dental floss to clean the mouth after you finish eating. Mostly at night you're supposed to floss with the dental floss to get rid of debris. These debris, if not removed, tend to get into action, and then they transient down to the heart. That's where you have conditions such as the myocarditis. You also have conditions like endocarditis and pericarditis. Another bad habit is lack of exercise and living a sedentary lifestyle. The heart, like every other part of the body, requires some form of exercise at some point in time. So you are supposed to give that to your heart if you want your heart to be healthy. Then a sedentary lifestyle, following a regular pattern of lifestyle. For instance, I say you wake up in the morning, you get breakfast prepared by someone else, you eat, go to work, stay at a particular point. When you are done, you leave the office with your car and get back to the house, eat, sleep, and tomorrow comes again. The routine also continues. That's a sedentary lifestyle. Then we also have abuse of drugs, especially antibiotics and antihypertensive drugs. You discover that in most developing countries like Nigeria and other countries, individuals tend to rely more on antibiotics, forgetting that there are other causative agents, and this in turn has led to problems of the cardiovascular system. Antihypertensive drugs that are previously prescribed for patients who have um, hypertension are repeatedly bought on their own by the patients to continue usage, which is not proper. So I would like to take you on some of the healthy habits, which is actually a contrast from the bad habits that we've just mentioned. One of them is stop smoking, especially the secondhand smoking. Most people say I don't smoke, but you're sitting close to someone that is actually smoking, which is really wrong. You inhale the gases that are left after the person has taken in the smoke, and this affects your heart negatively. Then eating habit. The eating habit is actually very important. It should be reduced sugar, reduced intake of salt, so that the viscosity of your blood will be normal. And then while eating also, individuals should take note of what we call cholesterol. Cholesterol is actually very necessary in the system of every individual. It is a combination of the high density lipoproteins and the low density lipoproteins and triglycerides. The high density lipoproteins is actually known as the good cholesterol, while the low density is known as bad cholesterol. So you should try as much as possible to increase your high density lipoproteins by taking legumes, fruits, walnuts, beans, and the likes of that to increase the level of high density lipoproteins, as this particular set of cholesterols mop the blood vessels of deposited fat and take them to the liver, and then the liver in turn will make sure that excess fat is removed from your system. Then regular flossing after eating, especially at night, you're supposed to floss with your dental floss to get rid of all those bacteria in the mouth, so that they do not stay there and get their cells active, then transient to your heart, and then cause one problem or the other. There are many outcomes that comes with having a bad heart. One of those outcomes is a heart transplant. We all agree that a heart transplant in most developing countries is not possible, and then the cost of having this done in a country outside yours is very expensive. So what would you rather be? Would you want to punish your heart and then get a transplant at a very expensive rate, or would you like to prevent any unforeseen occurrence from happening? Another bad outcome is the arterioplasty. This is a cosmetic surgery of repairing the blood vessels, and then that procedure is equally very expensive. Dialysis, like I earlier told you before now, the problem to one part of the body is a problem to the heart. When there is deficient blood supply to the kidneys, the ultrafiltration that's supposed to take place there will not take place, and then the heart will try to pump more and pump more and pump more. At some point it gets tired, and then this patient has no choice than to be going in for dialysis. Then another outcome is shock. Insufficient blood supply to vital organs will lead to shock, and another outcome is coma. Progressively from shock you have coma, and then you have death. So no one will want to die, so it's better you protect your heart, follow every precaution that is supposed to be followed, and make sure your heart is safe. Don't forget, it's the nurse's week. Look for a nurse and appreciate one nurse by words of mouth, by gifts, and by every other form of encouragement. Don't forget to subscribe to this YouTube channel and get ready to hear lots of other interesting facts from nurses. Like I told you before, my name is Nurse Maxwell, and I'm proud to be a nurse. Happy Nurses Week to every nurse out there. Thank you very much.
We are called to serve humanity, endowed with the art and science of caring. We are built on integrity and discipline that transcends through every generation. Immaculate and